My name is Grant Stevenson. I'm with the Isaiah organization, and these are members of the clergy and religious leaders from around this state, from around these cities, and we've come to do a midway check-in on how the budget process is going and how the legislature is moving forward in Minnesota. We are concerned that the standards have been set low. We're concerned that there has been a culture of meanness created at the federal level. The federal level where one party controls every single branch of government and continues to be stuck. In Minnesota, we have to do better. The people in Minnesota who are elected to positions in the Senate and the House and the governor need to look out for the citizens of Minnesota no matter what's happening at the federal government. And that includes the topics that we're here to talk about today, about the Health and Human Services bill, about expanding the ability for people to have health care, about the legislature trying to shut down the ability for people in Minneapolis and St. Paul to have earned sick and safe time, and about why so many standing in front of you today have begun opening the doors of their congregations to provide sanctuary for those who have been frightened and threatened by our government. In all of these areas and in many others, we need to do better in Minnesota. We can do better, and we insist that the people who work in this building take us and the citizens of Minnesota seriously and not work for those who are working against us. I'd like to introduce Reverend Paul Slack, Reverend Eric Hoffer, Reverend Mark Vinge, and Reverend Corinne Freeman Ellis, who will talk to us next.
Good morning. I am Reverend Paul Slack. I am pastor of New Creation Church in North Minneapolis. And I'm here to say that the faith community, we together, are deeply concerned about the direction of our country and about the direction of our state. As the budget is negotiated, we want to shine a light on the budget as not just a financial document, but as a moral document, a document that states our values clearly in terms of the direction that we're taking our state. The Minnesota budget reflects the morality, the values, and the intentions that we have, that we collectively state as who we are as a people. We are indeed a blessed state. We are living in a time of plenty. We see that about when we look at the surplus in our state. We're here to enact what we're saying by what we're voting for in the bill that is being proposed, to enact cuts to services that real Minnesotans rely on. And what we're relying on and what we're saying reflects our national politics and the meanness of that national politics more than it does the values of the state of Minnesota. And to that, we have great grief. Right now, the House Health and Human Services Omnibus Bill proposes to cut $599 million. That's tragic. This results in a reduction of services, obviously. This kind of massive cut threatens the care for over 1.2 million Minnesotans who are on medical assistance and Minnesota Care. These cuts are targeted at families with children. The worst kind of cuts possible are those that reduces the livelihood of families and our children. These cuts are also being proposed at a time of uncertainty. When we look at our federal policies and all of the risks that are being proposed, that are being voted on, all of the people who may lose everything, and then we in Minnesota would worsen the impact on all of our families and all of the communities that are here in Minnesota. Recently, Medicaid abruptly canceled its participation in our exchange. So now over 300,000 Medicaid enrollees must change their carrier and possibly provider by May 1st. We need our legislature to partner with us, the people of Minnesota, not with a corporation that use us like pawns in profit schemes. We need Minnesota to stand with the people who elected our legislator, not with the people that continue to pay them to further oppress us. We stand with God and with the people of Minnesota to stand on the side of those who are oppressed and who are most in need of us voting for and with them. Let's be people of the people. Amen.
My name is Eric Hoffer, and I am pastor at Prince of Peace Lutheran Church in St. Louis Park, and I'm a leader with Isaiah. I'm standing before you to call on our political leaders to support opening up Minnesota Care for all who choose to buy into it. Right now, clearly our healthcare system, and especially our health insurance system, needs help. But in response, the federal government is working to strip medical insurance from millions of Americans, including some of the most vulnerable of our citizens. And on top of that, as my colleague stated, our Minnesota legislature is attempting to cut massive amounts of funding to medical assistance and Minnesota Care. I believe it is a fundamental God-given right to receive stable and affordable person-centered health care. And everyone deserves this, especially children, seniors, and people with particular health concerns. So many of our political leaders address this fundamental right by lifting up the idea of the freedom of choice. But I'm not sure we see that being lived out very well today. For many people, the proposed healthcare cuts are leading to the types of choices that are between insurance and rent, between healthcare or childcare, between growing in wellness or being well-fed. Those are the kinds of false, amoral, unjust, ridiculous choices into which our leaders are forcing Minnesotans and Americans today. But real freedom is being allowed to grow and flourish when you trust that in the event of a health emergency, you will be cared for no matter what. And real choice is being able to pick between trusting caregivers, not tossed between whomever your insurance covers that year. The solution to this false living out of the idea of freedom of choice perpetrated by our federal and state leaders is giving people the free and equal access to stable and affordable health care, no matter who you are, no matter where you work, and no matter how much money you have. Real freedom begins, and just begins, with the Minnesota legislature partnering with the people of Minnesota and opening up Minnesota Care for all who choose to buy into it. Let us begin real and holy freedom today.
Thanks, Eric. I'm Mark Vinge, Senior Pastor at House of Hope Lutheran Church in New Hope. We all know that the U.S. Congress is not working. It's broken. Nothing is getting done. Therefore, all across the country, people are putting their energy into working at the local level. And they are getting things done. Both Minneapolis and St. Paul passed ordinances that guaranteed earned sick days for every person who works in their cities. That's fantastic. That's democracy in action, and it promises a better life for 150,000 people. But this legislature wants to take that away. And even though they still get paid when they are sick, they don't think everybody else should. In fact, they want to take away that privilege from those who are just about to get it. They have passed a scoundrel of a bill called preemption in both the House and the Senate that strips local control from every community in the state. It is undemocratic and it is mean-spirited. I live and work in the western suburbs. I would love to see workers in New Hope and Crystal and Plymouth and Minnetonka given those same kinds of protections. It would be better for them, and our communities would be stronger. But they will never get the chance if this legislation becomes law. Is that the role of the legislature, to go around undoing ordinances passed all across the state? Instead of creating positive legislation, they want to destroy dreams and the hopes of people. How is that leadership? How is that democratic? How is that moral? When children are sick, they need their parents to care for them. When some are faced either with losing pay or even living under threat of losing their jobs when they have to care for their family, that's crazy. This legislation aims to deny that basic fundamental need of 150,000 people. That is straight out stealing. It is theft. It is morally bankrupt, and we call on Governor Dayton to veto any preemption legislation that comes across his desk. Yes.
My name is Corinne Friedman Ellis, and I serve as Minister of Congregational Life at McAllister Plymouth United Church in St. Paul. My congregation, along with 32 other congregations in Minnesota, became a sanctuary congregation this year for those who are being threatened with deportation. Tens of thousands of undocumented people in Minnesota who have lived here for years, many for decades, feel threatened as never before with the hateful rhetoric of last year's political season and this year's public policy. We need our legislature in Minnesota to stand with us, not against us. We intend to protect our families, our neighbors, our friends. Our elected officials should share that same value. Local governments should follow the lead of Worthington and St. Paul, Northfield and Minneapolis, and pass strong separation ordinances so that our local police can concentrate on serving their communities, not serving the agenda of federal ICE officials. Our state government should be supporting this work. We are all here together. We come from places across the globe, but we are now a community here in Minnesota, and our futures are bound together. Our nation has been swept up in a tide of fear and distrust. Minnesota has to be an example of another way. Neighborliness, it's a simple value. It's an old Minnesota value. But we are in danger of forgetting that it is the best of who we've been, and it is the best of who we can be. Amen.
Amen. You folks have any questions? Yeah, there's been a lot of conversations, both here at the Capitol, but also across the state when folks go home for weekends or on breaks. Were you thinking of a specific piece of legislation? Well, I mean, as a matter of fact, that's exactly what we don't want to do, right? We want to be able to partner with folks across the state of Minnesota, and the issues that are raised here are affecting folks not just in blue parts of the state, but all over the state. The issue of earned sick and safe time, which is an ordinance that's passed in St. Paul and Minneapolis, but probably the largest group of people who need this in the state of Minnesota are in greater Minnesota.